Hello dentists, how are you today? Today we're going to talk about infective endocarditis. Before we start our topic today, I want you to subscribe to my channel and hit the notification bell for more videos. So let's start to know what is infective endocarditis. Before we start knowing what is infective endocarditis, we are going to talk about the difference between bacteremia and septicemia. Bacteremia means when bacteria is in the bloodstream, the presence of bacteria in the bloodstream, usually at a low level and clinically not of consequence. Septicemia is sepsis in the bloodstream and is due to large numbers of organisms in the blood. Clinical feature, rigors, fever, and hypotension. Infective endocarditis may occur as a complication of dental treatment. So let's know what is infective endocarditis. It is an inflammation of endocardium of the heart valves and endocardium around the congenital defects of the heart from an infection. So, infective endocarditis is an infection in the heart valves or endocardium. Let's know what's endocardium. It is the lining of the interior surfaces of the chambers of the heart. This condition is usually caused by bacteria entering the bloodstream and infecting the heart. So this means that the presence of bacteria in the bloodstream will lead to infection of the heart valves or endocardium, leading to the formation of infective endocarditis. Can you see here? This is the mitral valve, okay? And when the presence of bacteria in the bloodstream will cause the infection in the valves, okay, the mitral valves, okay, which leads to bacterial endocarditis. This is called bacterial endocarditis, inflammation of the mitral valve. Which organisms commonly cause infective endocarditis? Bacteria most commonly causes infective endocarditis. What are the types of bacteria that cause infective endocarditis? Streptococcus viridans, Streptococcus faecalis in patients with subacute infective endocarditis, and Streptococcus pneumonia, Staphylococcus aureus, and Streptococcus pyogenes in acute infective endocarditis. Fungi, chlamydia, and rickettsia less common cause this condition. What are the causes of infective endocarditis? What causes infective endocarditis? Dental procedures, okay, any dental procedure, filling, scaling, whatever, okay. Dental diseases like caries and abscesses may lead to infective endocarditis. Extracardiac infection like urinary tract, lungs, skin, bone, and abscesses. Cardiac surgery, instrumentation like urinary tract infusion, GIT infusion, or intravenous infusions leads to infective endocarditis. This is really important to know the causes of infective endocarditis. And of course, infective endocarditis is a very important disease for dentists to know. It's really very important, and it's because of its relation to our dental procedures, okay. Injection of drug use. Patients who are at risk of getting infective endocarditis from dental treatment, patients who have had previous endocarditis, those with prosthetic heart valves, those with surgically constructed systemic or pulmonary shunts or conduits are at risk of infective endocarditis from invasive dental treatment. However, they are also at risk of infective endocarditis from bacteremia. Any bacteremia or simple chewing may cause bacteremia. Importance of good standard. So how can we reduce or prevent how can we prevent infective endocarditis? We make good oral hygiene. We tell the patient to brush his teeth and use mouthwashes or other standards of good oral hygiene. And health is more important than giving patients off doses of antibiotics when they go in invasive dental treatment. No mucosal treatment indicated. So what precautions should be taken before carrying out subgingival scaling under local anesthetic in a patient who had previous endocarditis if they are allergic to penicillin? So what are the precautions should be taken before carrying out subgingival scaling under local anesthetic in patients who had previous endocarditis if they are allergic to penicillin? We can give them CHLORHEXIDINE mouthwash. Practice good oral hygiene. Brush your teeth at least twice a day, floss at least once a daily, rinse with antiseptic mouthwash at least once a day. Good oral and dental health is very important for patients at risk of infective endocarditis. Okay. The guidelines for taking antibiotics before dental procedures, and why do we have to give the patients antibiotics? Let's know now. So patients with mitral valve prolapse or the following diseases will take antibiotics before dental procedure. So it's very important to take a good case history before doing any dental procedure, for example extraction, okay, or endo treatment or any other procedure. Like for example, patients with mitral valve prolapse, rheumatic heart disease, bicuspid valve disease, calcified aortic stenosis, congenital heart conditions such as ventricular septal defect, atrial septal defect, and hypertrophic cardiomyopathy. All these patients will have to take antibiotic before dental procedure. Why do we give them antibiotic? To reduce the risk of bacterial infective endocarditis. We have to give them antibiotic to reduce the bacterial infective endocarditis to occur. Okay. Thanks for listening today, and I hope that today's benefit